So in today's top tip, I want to talk about what we at Peak Health Coaching call the 3 C's. And it's the core, we think, to having a really good coaching relationship with people. So it's about connecting, contracting, and coaching. And we deliberately talk about them in those orders because we feel until you get through the first two, it's very hard to coach. So connecting is all about building rapport and trust. And sometimes it takes time to do that. You might not get any further than that on the first 1 or 2 sessions maybe. And you'll use all your possible skills to, your language skills, your body language skills, the way you react to people to build that connection. Then we think you need to contract. Now that might be a significant contract of what you're going to do over a period of time, agreeing how long you've got, how many sessions, or it might be an individual contract for each session when you agree a shared agenda about what you're going to talk about. But the crucial thing about contracting is it should be based around what matters most to the person. There's really no point in trying to coach someone around something that doesn't really matter to them. And very often we find that people are sent to a coach by somebody else who thinks they know what they need. I think they need to give up smoking or lose weight. And that's not at all in line with what the person really wants, what matters to them. So you need to connect and then contract before you can coach. And of course, we go into all the coaching skills on our courses. But what we do remind people is if they're struggling with their coaching, then maybe you need to back up and make sure your contract's right. Are we working on something that's really important and meaningful to them? And if you're struggling with that, maybe you need to back up again to the connection and make sure that you've got that trust and rapport that you need to have that relationship. So the 3 C's: connecting, contracting, and coaching.